right, so welcome everybody. Thank you, Doc. We have Dr. Prehn here, and he is a third-generation dentist who has limited his practice to orofacial pain and dental sleep medicine only since 1992. He graduated from Marquette in 1981 and is double boarded in orofacial pain and dental sleep medicine. He's the president-elect of the American Board of Dental Sleep and is the adjunct professor at the University of Texas Dental School in Houston. He's recently published a peer-reviewed research article in the Journal of Dental Sleep Medicine and about the use of custom masks integrated with combination therapy to treat OSA. And he is highly regarded for his thoughts and research on combination therapy and teaches across the nation. So thank you so much for being here today, Dr. Prehn.
Oh, I always opportunity to share what we have. I'm always there for us.
Absolutely. Well, let's just kind of jump right into it. What made you get into dental sleep medicine?
That's actually a really good question. I was doing orofacial pain, TMJ, exclusively since, like I said, 1992. And about 5 or 6 years into it, I noticed that a lot of my patients had fatigue issues, chronic pain, things like that. And I started to think about what's going on at night. So about that time, about 1999, I met a physician, a sleep physician, who said that he could stop bruxism with a CPAP machine. Well, that was like a red bell going off my head, saying, wow, I've never heard that before. Let's investigate this. So we did some studies, and we had them published in '06 about how we can stop bruxism with CPAP, which is a fascinating link between the airway and TMJ disorders and headaches and clenching, all that. And that opened up that whole world of dental sleep medicine to me. Then I got boarded in 2006 in dental sleep medicine because it's such an important subject. And that's basically how I got into it, because of my TMJ patients.
That's fantastic. It's been so interesting to see the research come out, the correlations between certain issues, bruxism, or, anything else, heart disease, Alzheimer's, everything that's kind of coming to light, and sleep apnea. So
yeah,
that's very interesting. So what made you get interested in combination therapy with the PAP CS and the custom mask?
Of course, when you get into sleep medicine, you learn how to do the oral appliance, and that's the main tool that we all have, the main therapeutic option we have for our patients as sleep dentists. But there was a population of dentists who patients who did not respond to the oral appliance, so we could not achieve effectiveness, resolution, and they were also CPAP intolerant, and I was frustrated. So I heard about this young guy up in Dallas. His name is Dr. Keith Thornton, and he's become a friend of mine. But I went up to his office one day because I knew he'd been doing this for a long time, actually. And he showed me this custom mask that he was doing and the nasal pillows and how he connected it to the oral appliance, because he's working on post-polio patients. That's how it all started, which is a fascinating story into itself, of course. But he gave me this option where I could combine the two, CPAP and oral appliance, which I've never heard of before. And so with his permission, I started doing it in my practice down here in Houston, because we have a huge practice, and we're able to do many of these appliances. And that's basically what got me into this combination therapy, is for those population of patients that I just didn't want to stop and abandon them. I had to continue on. And Dr. Thornton gave me that option with these two devices that he invented and developed.
Yeah, I think that's really interesting because, while we know a lot of people can be treated with simply oral appliances, there is those, that group of patients who can't be. And so what do you do with them, and how do you get them, and how do you get them the help that they need so that they can, get the relief and the treatment? So I think that's really exciting. And that's why I love, working for Airway Management. We have that full system of products from the temporary trial, MyTap, all the way up to the PAP CS. And then you have the step above that, which is the custom mask. So I really love that we're able to treat that full spectrum of patients there.
Exactly. And they're there. I mean, they're patients all along the way.
Absolutely. So I know in your courses, which we'll talk about a little bit later, but you kind of teach the emphasis of working with the sleep physicians to treat those types of patients. I know one thing I hear often is that starting those relationships can sometimes be tricky or difficult. Do you have any advice for the listeners on maybe how to start a relationship with a sleep physician? And I know that's probably a little bit long-winded question, but and we'll talk about your courses in a little bit, but a short version answer of that, if you have.
Yeah. Well, being a third generation of dentists, of course, we have as many generations of physicians in our family. So it was natural for me to work with physicians. My brother's a physician, my uncle, all that. And so I find that it was a natural combination. Combination therapy was a natural bridge to the physicians, because dentists alone cannot do combination therapy without collaboration with the physician. It was a natural bridge to the physicians. And my thought is, when I teach this to dentists, to establish a relationship with a physician, they're in a bind right now. They are looking for dentists now. I think they're beginning to understand the importance of the role of a dentist in sleeping with these sleep patients. And so they are looking for qualified dentists. So my advice to dentists was always, get yourself qualified. And that means like the AADSM has a qualified dentist designation now. Perhaps go as far as getting a board. And that will tell the physician that you are serious about treating these patients. And then I have the dentist come up with a standard operating procedure, how he titrates, how he communicates with the physician. Go to that physician and say, this is my proposal on our relationship. I want to work with you. I'll do pulse oximetry for my titration. You will see every report I get, and you will end up seeing the patient at the end to determine the effectiveness of the treatment that I want to provide for them. And so it's start talking to the physicians. Now, a great natural bridge, like I said before, is this combination therapy, because they are stuck with this 51% compliance to CPAP nationwide. That was done by the Gay study back in 2006. And so they know that. They have issues with CPAP tolerance and all these things. So you come to them and say, give me your CPAP failures, and I will add an oral appliance to it, and next see what happens. Keep them in CPAP. And that they are really open to, and they would love to hear that from any dentist who walks in their office. And so that, to me, is how you start a relationship, by saying how you can help them with their patients.
Right. The communication and showing them what you can provide, and making sure that, you know, at the end of the day, it's about that patient and getting the patient treated, whether it's with you, with CPAP, however it may be, getting them treated. And, you know,
so even physicians who don't understand or believe in oral appliances, when they see that custom mask, when they see those PAP CS connected to their own device, they get that. You know, they know the CPAP, and they know that mask is their biggest reason for failures. And here you're providing a stable mask connected to the dentition, the skull base, and they understand the stability of the mandible is critical for CPAP compliance and effectiveness. That, to me, is the greatest marketing device a dentist can have, as far as open up doors to physicians, because they get this combination device.
It's a great bridge, so to speak, to kind of bridge that gap between solely oral appliances and dentistry and solely CPAP and physician. So hopefully we can continue to bridge that gap. So you recently had a first of its kind study published in the Journal of Dental Sleep Medicine. What would you say is the significance of that study, and what did it say about the custom mask?
Good question. Actually, the significance is that there's never been any study on combination therapy to that degree. The other significance is that I co-authored it with a physician. So we have a dentist and a physician on the same paper, which is really rare. So we were able to determine that the custom mask is what the study was about. Really works best for people at the severe end of sleep apnea. These are the people who the pressures are high. They couldn't tolerate the mask. It was leaking, and they were we had 75 patients, and we showed that the main bulk of the patients who got the custom mask were those on the severe end. And that's kind of put the custom mask as the last stop for these patients. And then now it's been actually validated, the research that it came out. It was significant for physicians to read this study too, because they know now what dentists can do to help them.
That's awesome. And we'll post a link in the comment section here so that you guys can see the study and read the full study if you'd like to. So what would you say is the difference between a TAP-PAP custom mask and a TAP-PAP CS versus simply just using, you know, any CPAP mask and any oral appliance? And I think you have some demo models with you that you can kind of show our viewers too.
Yeah, you have an eye for critical questions. This is really a good question because in the last couple of years, I've developed combination therapy and the terminology, and I've come up with the two different types of combination therapy. Type 1, which is what we call dual therapy, that's people who are wearing a CPAP and then just an oral device by itself. They're not connected. They're the patient with two different therapies on them at the same time, dual therapy. So they're wearing an oral appliance to stabilize the mandible, like a TAP 3 or something, or Dream Tap, and then they have a CPAP with it. And that accomplishes great strides in getting the patient to stay in CPAP and becoming very effective. Then the second type of combination therapy is called integrated therapy, because now we're integrating the CPAP with the oral device directly. And that's the TAP-PAP CS and the custom mask. Those are basically right now, those are our main and only points of therapeutic options for integrated therapy. And so what we generally do is when we teach this, the first thing we make is what they call the fusion monoblock. This could also be a TAP 3 device that you can screw a post on. Either way, it turns out to be, we connect them together, upper and lower shell, with the post. So it goes in the mouth.
That's awesome.
And the post sticks out. Now, what can you put on this post? Because this post now is connected to the dentition, which has stabilized the whole skull base with the mandible. And on that post, the first thing that's very simple to do is get a TAP-PAP CS kit, and you connect it onto the post. You slide it right on, and you put it in the mouth.
So simple. And I'll talk for Dr. Prehn right now. It's literally as simple as sliding that TAP-PAP CS mask onto that post. It's a very simple 10-minute procedure to put everything together. So
yeah, it's just
very simple.
Right on. And we teach this in our courses as the first line of integrated therapy, because nothing's touching the face. If you notice that there's not a single strap, nothing's touching the face. It's just nasal pillows right in the nose. And that has become very effective. Now, it's very effective for CPAP pressures. You know, CPAP goes from 0 to 30, most of them around 10, 11, 12. When you get up towards 15, the pressures get to be high, even for the nasal pillows, and you start to leakage out the side of the oral device. And you get what I call the horse thing, like that. And the air is leaking out the side and coming out the mouth because it's taking the path of least resistance, because now you're talking about a patient with a bit smaller airway, larger, fatter neck, and the air is coming out the side. So now you need a mouth seal. So then you take that same oral device and you take it and put it in a patient's mouth, and you take an impression of their face. And off that impression, take a model and you fabricate a mask to fit that face.
And
exact
so
duplicate.
100% custom fitted to their face. It's not like a normal full face mask where it just, you know, one size fits all kind of situation.
No, it's customized to their impression of their face, which we're in the future moving into facial scanning, maybe on an iPhone or something. There's some programs we're looking at, and you can scan the face and have this fabricated from a 3D printer, hopefully. That's coming up. But right now, this sits gently on the face, and the air goes into the mouth or into the nose, and it pushes the skin up against this, barely touching it, and it seals it with the skin going against the mask instead of the mask being pushed into the skin. And then you take this custom mask and you attach it to the same post, like so. And now
So now they have a great seal and no straps, and they're not having that mouth leakage issue as well.
Right. This can take pressures up to 30. Well, Dr. Thornton worked on those post-polio patients. Their ventilators went up to 65 centimeter of pressure, and these things kept the seal at 65. And so this can take any CPAP pressure whatsoever. The other neat thing about this mask is that some people who are mouth breathers, we can communicate, we can change where the pressure goes in this mask, into the mouth or into the nose or whatever, so the options are limitless with this custom mask.
So it's really helpful for patients who, like you said, need that CPAP therapy, but just can't tolerate it. And that's a large percentage of the population who, can't.
Especially those on the more severe end.
Right.
Now the PAP CS, since it's so simple to use and tolerated very well by the patient, sometimes, if you, I do a lot of TAP 3s because of this option, a TAP 3 and a Dream Tap, you can take and add the post to it. Let's say you're advancing them with the Dream Tap and they get to a point where they can't go anymore, but they're still clenching or still got fatigue and they're saying, need a little bit of better efficacy. I'll put a PAP CS on there for just a few months to get everything to calm down, to get the airway to calm down, and then we'll move back into the Dream Tap without it. And so this PAP CS you take on and off. It doesn't cost that much. The kit doesn't cost that much. The patient gets to where he needs to be, and then you can use it, take it on and off. Some people will use the PAP CS at home and take it off and wear the Dream Tap travel.
Right.
So there's so many options with these devices. They're just incredible.
That's fantastic. So obviously they can get way more information if they attend one of your courses. So could you give me a little bit of an insight into what your advanced courses in combination therapy teach, what people can expect to learn, and we'll post the information and the links so that they can check out your courses and register. But just give us a little synopsis of your courses.
Well, our courses are on the fusioncustommask.com, which will be the link you'll put on there. We're teaching one in Atlanta and then one in Houston, and basically I've got it to a one-day course, and it's all about combination therapy, not necessarily these devices. We teach these devices. We teach how to make a face mask and how to make impressions, and we also teach about how to communicate with the physicians. It's basically start to finish combination therapy. I don't go through any of the basic stuff. We just get right into, minute one is talk about combination therapy. I talk about the history, and we take impressions on each other, and we work with assistants, because to tell you the truth, you can't do this successfully without a really well-trained staff. I mean, the well-trained assistant, and I encourage my dentists who come to bring their top assistant with them, because she's going to learn how my assistants work. They do the bulk of the work. They set up the impression, they set up the monoblock, they calm the patient down, they walk them through the whole process before I even walk in the room. And so it's critical that the assistant's involved with this process. So we are also looking at making some online videos that maybe perhaps a dentist may be able to learn to do this without coming to the course someday. That's all in the future, but that's what we teach them, combination therapy, not just device, but the actual therapy.
That's fantastic. Well, we got a lot of information in
Yeah.
a short amount of time. I wanted to thank you again so much for being here. And don't forget, anybody watching this, to check out the links in the comments or in the information section so that you can get more information on the PAP CS, PAP custom mask, where you can get those from, and also the links to the studies and the courses. So we got a lot of information that we covered today, but I wanted to thank you so much again, Dr. Prehn, for taking the time to speak with me and provide, that information to our listeners.
Well, thank you for the opportunity to share this critical information. There's so many aspects to it. Physicians, collaboration, the technique, and basically the winner is always the patients. So I'm always happy that happens.
Wonderful. Well, we will sign off here today, and I hope everybody has a great day. Thanks.
Okay. Thank you.